So this is the armamentarium for suturing. First and foremost, we have the suture material, then we have the needle holder, we have the adsense forceps, and lastly we have the scissor. Starting with the suture material. So the suture material will be inserted in the needle. Always hold the needle at the eye area when you are pulling the suture material. As you can see right now, it's at the same length. We need to make one length shorter than the other, so hold at the eye level and pull the suture material so that one end is short and one end is long. So that's okay. Moving on to the needle holder. So you need to use your ring finger, middle finger, thumb and index finger for this. As you can see, that's the hinge or the joint area. Use your thumb, use your ring finger, index finger on the hinge and middle finger near the lock area. And that's how you open and close. The index finger should be around the hinge area. So you lock and unlock using your middle finger. So it's placed near the lock area and then you press down at the lock area for it to open. Then you get back into position, take it back, it closes. Again, when you press down using your middle finger, it opens up. Moving on to the adsense forceps, which is used in conjunction with the needle holder. So whenever we are suturing very lax tissue, we can use the adsense forceps, which is also called as a tooth forceps, to support the tissue. So now, how to hold the needle in the needle holder. So don't hold it at the tip of the needle, you should hold it either at the middle of the needle or else 3/4 away from the tip of the needle. So that's where you hold it. Another thing to make sure is don't hold the needle away from the tip of the needle holders. As you can see, if you hold it away from the tip, your needle holder will go and hit the alveolus and it's not easy. You won't be able to suture like that. So always make sure to hold the needle at the tip of the needle holder, and then you can easily suture through the soft tissues. Now there's a modified technique for intraoral suturing, so you can hold the needle holder in such a manner, and this is a modified technique for intraoral suturing. So this is for suturing the mandible. You take a bite and then you get the needle through and then you take it up. This is for maxilla. The needle should point downwards. Again, I'm repeating, for maxilla the tip should point down, and that's how you take the bite and get the needle through. So there's a 3-step technique for suturing when you insert needle. So the first step is bite, then you turn and you pull. So you take a bite, you turn, and then finally you pull. Maxilla, again, the 3 steps don't change. That is, you take a bite, then you turn and then you pull. We'll show you a demo for suturing with respect to second quadrant.